Welcome back to another podcast of Heal Without Harm. My name is Dr. Clayton Dir. I am a physical therapist, and today we are answering the question of what is dry needling. If you've found yourself along this podcast, you have heard about it. Maybe you have had a friend tell you about it and their experience. Hopefully it was a positive one. The majority of people's experience is positive, but I hope to answer all the questions around it, or at least give you a quick 101 class on what to expect if your PT or chiropractor or whatever your medical provider that you go to is, if they suggest it, you have a little bit of background on what's going on. So dry needling is not acupuncture. The only thing that it has in common with acupuncture is the needle in which we use. We are using the same needle, but we are using more of a Western medicine, physiological, mechanical type approach. We are not looking at the flow of chi, your meridians, and things like that. Acupuncture has been around for a long time. I don't know a whole lot about it, but I know that we are not doing acupuncture ultimately. In general, to my understanding, acupuncture, the needle is only going into the skin, maybe the dermis, and then they leave it there. There's not too much manipulation of that. When it comes to dry needling, we are going on a more muscular approach, although there are some methods that we can go on a more neurological approach, getting close to the nerves to try to get them to calm down or maybe get a little bit excited so that we can function better. Moving into the way I use it most, the majority of the time when I use dry needling with clients, it is due to try to break some sort of muscle spasm. Some people can call this a cramp, a muscle spasm, a trigger point, or a knot in the muscle. Or even think pressure points is another one to kind of consider. And so if you're listening to this now, I'm guessing you have enough questions, probably coming back to some problems that you have. So your pain or your trigger point or whatever you'd like to label that may be in your upper trap, it may be in your shoulder blade, it may be in the front part of your shoulder, maybe it's in your lat, kind of under the armpit area, maybe it's in a hip muscle, your glute, quad, calf, fill in the blank. Most providers like massage therapists or chiropractors, PTs, we're all going to try to approach the treatment of that dysfunction in the muscle a little bit differently. A massage therapist is probably going to rub it multiple times. Maybe they'll have a sustained hold on that muscle. A chiropractor generally is going to pop the joint closest to that area to try to get the muscle spasm to go down. And then a physical therapist is probably going to use dry needling, more of a hands-on approach, or maybe even some sort of scraping or something like that to try to break that. You can also self-treat with things like lacrosse balls or foam rollers. We're all trying to do the same thing. Get this muscle to relax, break the spasm, and then get back to moving pain-free. Dry needling is the one that, in my eyes, has the leg up because of all of the approaches that I described before is doing more of an external approach. We're trying to do something to the body with our hands, with a ball, or something like that that is not going into the muscle. This comes into large play when we have muscles that are thick or deep, and we can't really get our hands or elbows or a ball or a foam roller all the way down to that muscle. So let me paint a picture for you. You can have people in one or two camps. You can have someone who just started running for the first time in forever, and so they have this repeated trauma or repeated use of this muscle that they're not used to over and over and over again. And the result of that is knots that kind of come up in the calf or the quads or the hip. And so they say, I have pinpoint pain right here, and they point to the spot. You also have someone who is playing tennis and maybe they stepped back and then went to take off, and that led to a quick spasm of the muscle or quick cramp, and it's stuck in spasm. This is kind of the route that we go on. So it develops, like we talked about, we'll call it a trigger point. You can try all those other methods that I described, or you can go with something called dry needling. This is different because although we are treating the same problem, we're able to take that needle and go into the muscle itself, into that muscle belly, into that spasm. What is really cool about this is the client themselves gets a ton of positive feedback in the sense of, wow, you are recreating my pain. Like, that is my pain. I can feel right where the problem is. So you get this tremendous buy-in from the client, but also positive confirmation as the provider that we are in the right spot. And for me, when I'm palpating around on that muscle, I'll get this little like twitch-like response just from rubbing on it. Then when I poke the needle into it, we'll get this big twitch response that usually feels like a really weird cramp to you. And then we can immediately retest whatever was painful before that, and the pain has dropped a lot. And so what's happening when we get the needle into that muscle, which again, it's called a dry needle because we're not injecting anything or pulling anything out. These needles are insanely tiny, especially compared to the classic syringe that you may use to get your blood taken. So poke the needle in, we get that big twitch response. And what's taking place is multiple different things. The muscle itself is getting a little bit of a neurological reset. And what I mean by that is beforehand, it had spontaneous electrical activity, a very fancy way of saying it was stuck in spasm and it ultimately can't turn on and off under its own power. The dry needle helps reduce that. It's also going to decrease pain in general. We know people's pain thresholds go up after a dry needling session. You get a ton of blood flow to that area because the body's like, what in the world is happening? Send blood flow to try to heal this up. You also get an injury signal to the brain. So the brain is like, wait, something's going on here. We need to go solve the problem. Sends local inflammation to that area, which is the first stage of the healing response. I know in today's day and age, inflammation is usually thought of as a bad thing, but in this case, it's a very good thing because it starts the healing process for you or revamps it if this is more of a chronic style issue. The last thing that takes place with this is ultimately overall decrease in your symptoms, which I know goes along with pain. Here's a really good example. I had a patient come in, this was 6 months ago or so. He had bilateral knee pain, which means knee pain on both sides. I had him go through a barrage of tests, and we boiled it down to a bodyweight squat would cause him about 8 out of 10 pain. He knew nothing was wrong, and so did I, but it was very intensely painful. I then had him do a wall sit, and traditionally I always like people to try to do as much on their own before we intervene. He was able to do a wall sit for 30 seconds, moderately painful, and then went back to do that bodyweight squat, and his pain dropped from 8 out of 10 to 6 out of 10. Pretty good change, about 25% decrease. Then we palpated around in his quads, which is the muscle in the front of your thigh, just above your knee. And I dry needled both quads. He then did 5 bodyweight squats after the dry needling session, which took a matter of maybe 3 or 4 minutes, and he had 0 pain. Then we took him out to the gym and we put a load on his back, so a barbell. Once we got up to about 100 pounds, the pain came back, but it was only like 2 out of 10. So now we increased the capacity of his muscles because we were able to decrease the pain experienced when squatting. And so what that does is it actually opens a therapeutic window. And what that means is there's a period of time that he's going to have less pain, so he can go do exercises that were previously painful. Here's where I want to bold, underline, italicize the words that are about to come out of my mouth. Dry needling is not a problem solver. It is a pain reducer and a shortcut so that when you go do the exercise recommended by your provider, they pay off a lot more and you're able to get results quicker. If you don't go do the exercises and if you don't do what's recommended in the plan provided to you, the pain will probably just return right back to where it was. So you have to put in the work, especially when the pain is down, so that the pain doesn't return as high as it was. And then we repeat that. I think a general protocol is about once a week for 4 to 6 weeks, and you will see continuous improvement of strength and mobility along with decrease in pain. Athletes and club teams, load up your gear with Van Gogh Transport Services. Led by local Ironman triathletes, Van Gogh safely ships your bikes, team equipment, or even bulky luggage to out-of-town events. Focus on performance, not logistics. Explore more at vangohtransport.biz. And so again, dry needling in itself is going to be a massive shortcut, but it is not a problem solver. It needs to be done in tandem with proper exercise, generally recommended to you by a provider. So there's a lot of different things that go into what is dry needling. And I want to reiterate, it is not acupuncture, and it is very, very helpful to supplement exercise moving forward. One of the last couple things I want to talk to you about today before we finish up, because I want this one to be short so you can pass it on to a friend or family member, is there's multiple different approaches when it comes to dry needling. The one that I use most often, although I know there's a lot of people that will poke holes in this theory, is more of the trigger point approach. I rely on a barrage of different tests, strength, mobility, flexibility, all those. Then I will palpate along the muscles that I think are a problem. And between all of that, I will generally find tender spots, generally referred to as trigger points in the muscles. And if that recreates your pain, then it tells me that's where we need to go. And that's usually where I get most, if not all, of my results on that first day or any point in time that I'm trying to drop pain in this patient. So you have the trigger point approach, which with that, I will use more of a pistoning technique, which for anybody listening that wants to learn about dry needling, if you're relatively uncomfortable with like discussing dry needling, I'll try to keep this very surface level. If you have more in-depth questions, please DM me on Instagram or reach out to me in whatever way you can through the bio down below or on the page of this episode. However, we use what's called the pistoning technique. And so I will try to redirect the needle multiple different times to try to find the most bothersome or spasmed area in that muscle. That's where I get a lot of results, although it does come with a little bit of soreness, which I'll talk to you about the experience with dry needling as the patient here in about a minute or two. And so that's where I get most of my results, although it does come with some soreness that lasts a day or two. The other approach, or one of the other two approaches that I know of, is an electrical stimulation approach. I would say in traditional in-network PT or chiropractic care, this is the one that I hear about the most, but most specifically, it's the one that I hear that people do, and they get minimal results. They do get pain relief. They do. But it's not as much as the method that I use, which is the pistoning, which of course is why I chose it. I've tried all the different techniques. With the e-stim method, they'll generally put in a couple needles, and then they will hook them up to electrical stimulation. This is not that much different than the sticky pads on your back, like a TENS unit or interferential current. The difference is we can get very specific on which muscle we're working with, and we can get more of that muscle recruited because the needle is within the muscle, not just sitting on the surface of the skin. This one is a little bit more helpful if somebody is like very averse to the needles, or if they're having a high amount of pain and we think it would be too aggressive to do the pistoning technique on that trigger point approach. The e-stim is a little bit more of a calmer approach, leaves them less sore, can downregulate muscle spasm, a little bit softer or easier, and so it's not so scary for the patient. It's not so responsive for the patient ultimately. This one usually yields less in-depth results, less beneficial results, but results nonetheless. Oftentimes this is a starting point for me, or we've tried our traditional method for 2 or 3 treatments. It's not working as well as we'd want. Let's try a different approach. So I'll bring out the e-stim unit. A couple of the therapists in our clinic, they'll pull it out a little bit earlier. We all have different approaches, but we all get results. The last approach, this is the one that I use the least, but one of our docs, Dr. Kirsten, she uses it probably moderately to most often because that's the techniques that she was taught. This one operates more on the nervous system and what's called like it's almost like clusters of nerves, like plexuses of nerves. So right where a nerve will split into numerous areas, there's generally what's called homeostatic points in that area. And so if you can get the needle somewhat close to that, you can actually what we call downregulate the nervous system. So we can get the body to calm down a little bit, which will further help with pain relief. That one I know less about, but it's one that we can kind of overlay with the traditional dry needling to help treat that system. If you want more information on that, again, DM me. I will give you that content, and I can also hook you up with Dr. Kirsten so that she can answer some of those questions for you. To finish out, here's what the experience looks like. A normal visit with me in regards of an evaluation will be an hour long. People come in, we chat for anywhere from 10 to 20 minutes reviewing all of their paperwork and hearing their story on what's going on. From there, we will follow it up with a bunch of objective tests to rule out scary stuff, rule in what I think is wrong, and then check overall strength, mobility, and do usually about a half body analysis. If it's lower body injury, we look at the lower body, upper body injury, we look at the upper body, and then as pain improves and we start to do more, I start to check everything out. Then we move on to treatment. So we find something that is painful or weak. We treat them with dry needling traditionally, as long as they're a candidate for it, but most of the people that walk through my door are. And then we finish with some exercise, like I said, that will actually fix them as opposed to just treating them. During that dry needling session, usually the first time, we'll poke 3 or 4 different areas. That will take no longer than about 5 minutes, and I'll talk them through some of the stuff that I've talked to you about today. Most of the time in the area, they may or may not feel the initial poke. Like I said, these needles are super small, and so sometimes you don't even feel it breaking the skin and going in. However, when you're sitting there and I'm trying to find this trigger point, it's very normal and expected to feel weird sensations. Most of the time, the most common word I hear is just, that feels weird. It feels deep. It feels like a weird ache. The word that I like to use when I get dry needled is, I feel this weird twang. I don't really know how to explain that any other way. But you get this weird sensation in the muscle, and it often feels like a really quick Charlie horse or cramp in the muscle, or maybe this twitch or flicker. If it's a muscle that is known for referring symptoms, there's some in the hip and some in the shoulder that will be known for referring down the leg. That's usually when I ask, what do you feel? Describe it to me. How far down does it go? Do you want me to quit? What are you feeling right now? And we'll talk through that. Afterwards, when we get done with this, we generally know that you're going to feel sore for anywhere from about 1 to 3 days. The correlations that I've observed anecdotally is the older and more sedentary you are, and those can be separate than each other, but the older and more sedentary you are, the longer that you'll feel the soreness. The more active and the younger you are, the quicker that soreness will wear off. Usually it's gone within 48 hours. So if I dry needle you today is Friday, by Sunday you're like, hey, most of the soreness was gone. Saturday was a little bit tender. That would be expected ultimately. There's usually no precautions or don't do this right after, you can usually go back to your normal life totally fine just after. And if anything, you can move more fluidly. If it used to hurt to put your seatbelt on, now you can do that pain-free. If it hurt to get out of the car because it hurt your knee, you can now do that pain-free, or at least a lot less pain. That would be the experience that I would put before you and say, here's what you can expect. That right there is dry needling in a nutshell. I hope that if you're interested in this gives you a little bit more clarity, or at least raises a little bit better questions so that you know what to ask when you're talking to your provider, whether that be me, somebody here at Team Natural Wellness, or the provider in your area. If you have someone that you think dry needling would be good for, please send them this podcast. I did my best to try to make it nice and understandable to everybody that could be listening, but also very in depth to the point where they know kind of the science behind what's going on. This could be something that's very helpful for you or a family member. It's something that's getting a little bit more traction, but still very, very, very unheard of, which is really interesting to me. It's something that definitely gets us results quicker than just exercise alone, and I think more providers should use it. If you're also listening and you haven't, this is when I'm going to ask for a little bit of help. I would love for you to leave a review, whether it be on Spotify or Apple Podcasts. We've already got a good amount, and it makes me very happy, and it helps us grow the show and helps us get more high quality guests on the show. If you'd like to, please leave a review as well. Those things are actually separate. I was unaware of that until as of late, that you can leave a rating, but you can also leave a review, and both help independently of each other. Thank you so much if you have already left one. Lastly, if there's anybody that you want on the podcast, please reach out to me via Instagram DMs or TikTok DMs, or I believe I have my email somewhere in there, or you can go onto the website and get that sent in. If you have any other questions, reach out to me. I am very happy to get this one out there so that more people can know about dry needling and the benefits of it. And hopefully today you learned a little bit more and heal without harm. Thank you so much.